Almost ready.
No worries.
This little status bar just takes a while to. So,
Yeah, no problem. I don't think this is going to go 30 minutes either, so just
gotcha.
FYI.
All right. Sounds good. Okay. Almost ready. Okay. We are all set. Go right ahead.
Okay, great.
Excellent.
Thank
All right.
you for joining us for today's webinar. I'm Liz Nolan, Community Outreach Coordinator for the Northborough Health and Human Services Department. Our monthly webinars highlight our department's staff and resources available to residents. The webinar will be recorded by Northborough Media Connection and can be viewed on their YouTube channel. Today, we feature our health agents, Vinnie Gu and Chris Craig. They do a lot more than you may think. And with that, I will turn it over to Chris.
Yeah, hi all. Thanks for coming to our presentation. Basically today we're talking about what does a health agent do? Um, Wanted to come in and basically just kind of tell the community, some of the things we do, some of the services we offer. Um, from a very broad scope, the health agent, our job is to enforce public health laws at the local level. So our goal is to promote and protect environmental health via the enforcement of related laws. Um, we kind of cover a subdiscipline of public health called environmental health. Environmental health is that branch of public health that involves aspects of both the natural and the man-made environment that can affect human health. Um, and the laws that are related to environmental health, they're enforced at the local, state, and federal level. Where we are as health agents in the municipal, environment, we are most working with the state at that level. They often set laws, and the Board of Health, the local Board of Health, as agents, we enforce those laws. So I'll move on to my next slide. These are some of the major subdisciplines of environmental health. As you can see, there's a lot of them. This is not an exhaustive list. Basically, if it's, anything relating to the natural and the man-made environment that can affect your health, it's something we're interested in. You know, I highlighted some of the biggest ones that we as local health agents um, kind of cover, but these every item you see on the list is something both me and Vinny have seen in our line of work. Um, Food safety, housing standards, wastewater disposal, recreational water, illness prevention, and disaster preparedness are some of the biggest things we do on a day-to-day at the local level. But kind of like I mentioned, all of these items we are interested in and we've, come across, we receive trainings on, and, sometimes these items come up more sporadically. The point I kind of wanted to make is every town is different. Some of these items you see on this list might be something super common for, say a bigger city or town that might have different needs. A good example is solid waste disposal, just so happens in Northborough, waste disposal is typically handled by Department of Public Works. There's some communities where, that falls for the Board of Health and, they're responsible for waste disposal program. And yeah, it's so it really the public health agents we basically it depends on the town and what the town's needs are. Northborough in particular, there's a lot of restaurants, food establishments, so that tends to be a big part of what we do is food inspections. Whereas there's also, a good amount of septic systems, good amount of uh, rental housing, that sort of thing. So it keeps us busy. An example like recreational water. We have a lot of pools, but not so much bathing beaches just because we don't happen to have any public swimming areas. So yeah, these items really depend on the town. So we'll move on to food safety. Vinny Gu is our big food expert here, so I'll let him take the floor.
Thanks, Chris. Just wanted to introduce myself real quick, and thanks, Liz, for setting this all up. So my name is Vincent Gu. I've been a health inspector for the town of Northborough for about 3 months now, and I also work in the town Southborough, Boylston, and Westborough. But like Chris was saying, I'm the primary food safety inspector, and I think the world would be a scary place without health inspectors and people going in and out of food service. So for food safety, my primary goal and task is to permit and inspect commercial food operations, any restaurant in town, anyone that carries a food permit to prevent those nasty foodborne illnesses and outbreaks that do occur. Um, our establishments are regularly inspected about twice a year to ensure compliance with the FDA food code that we use as our primary document to refer to. And health agents respond to food safety complaints and all possible foodborne illness reports. So anytime somebody gets sick from a restaurant or anywhere food is permitted, we both look at.
Excellent. If you're good there, I'll move on to our next slide. Housing standards. So this is another big one in the public health realm. So health agents, we enforce the state sanitary code, which sets the minimum habitability requirements in Massachusetts for housing units. So most often this looks like, say, someone is renting a unit and, they're having trouble getting repairs made. The state has set these standards, so often the owner of said properties are responsible for maintaining the structural integrity of properties and, beyond. So the way that looks is, if there's concerns, residents are always able to request from us, the health department, an inspection of their unit. We go in and we make sure it's up to those minimum standards to obviously ensure that the housing is safe and healthy. If we find that there's violations of the housing code, basically the responsible party is issued an order to correct said items within an allotted amount of time that's defined by the law. So it's a common thing to, obviously make sure, housing is safe, healthy, clean. That's our primary goal. We want to make sure everybody has access to, those essential utilities, and we want to make sure, these units are weather tight, free from pests, the things that just kind of are conducive to a safe and healthy home. Septic code enforcement is another big item we do here in Northborough. We have a sewer system in Northborough, but I would say that serves about maybe half the residents. So in other, areas where a sewer exists, every, home has to have its own private septic system, for the disposal of wastewater. So the health agent, we have a big role in these. Basically, we go along the whole way. We enforce Title V of the state environmental code, which is all the laws governing the construction of these wastewater systems. Basically, we start at the point where an engineer will design a septic system based on the kind of the nature of the property. We're looking to see what does the soil look like. We're seeing how high is that groundwater under the soil. And basically the engineer will create a septic system based on those parameters, based on the setbacks on Title V, all these design criteria. We, as the health agent, will review the plans. We provide feedback to the engineers. We make sure, they meet Title V. And from that, the plan will get approved, and then we inspect the construction process to ensure that the plans are being installed per the approved plan, basically, to make sure that those septic systems are meeting Title V standards. Our goal is to obviously protect human health and groundwater. We don't want effluent from the septic system getting to those places without the proper treatment. Excellent. We have recreational water standards. There we go.
Okay, so for recreational water standards, public and semi-public swimming pools are permitted and inspected by health agents like us to make sure the water quality is safe for swimmers. Now, in order to do this, Chris and I have to be CPO certified typically, so certified pool operator, and that's a course. It's a couple days, I believe, and that's all about how to inspect pools, how to do the water test. There is a little math involved, but just to add a little color to what it takes to learn how to be an inspector for inspecting pools. And then bathing beaches are periodically tested for potentially hazardous microorganisms that you could encounter without the proper systems in place.
Yeah, so the big part of it is water chemistry, just
Yep.
testing to make sure the water's at that level where, it's not going to negatively affect human health. At the same time, you want to limit chlorine, especially super important with pools. You want to make sure that water has enough chlorine to kill any of the microbes, but at the same time, you don't want too much. So, it's irritating your skin, damaging the pool. as well as, looking for the actual structural things around said pool. We want to make sure,
Yep.
Everything's structurally sound. We want to make sure lifeguards are available.
Exactly.
All these safety measures are in place, emergency phone, all that good stuff. So super important because, as we know, pools can be very dangerous. Um, Excellent. Another thing we do, and this is pretty unique to Massachusetts, is we do recreational camp licensing. Um, Basically, summer camps for kids, very popular, while, schools are on vacation. So basically, the local boards of health are responsible for making sure that any private operators that are running a summer camp meets Department of Public Health standards. So basically, what we're looking for is to make sure, you know, all their employees are, their background checked, make sure, they're suitable to work with kids. We want to make sure that the grounds they're using are safe, all their equipment and, their facilities are good. Goes along with the pools. Oftentimes these grounds have pools. We're inspecting the pools. We're inspecting, where they eat. We're making sure everything's up to snuff. We also review the health side of things. We want to make sure, depending on the size of the camp, the nature of the camp, is there a nurse on staff? There's always got to be someone that's responsible for the health record side of things, making sure, there's somewhere the kids can go in case, stuff happens. These are kids playing outside, kids get hurt. We want to make sure, things are being properly documented, as well as, you have the correct resources to ensure, those kids are well taken care of. So that's a very important part of our job, very busy in the summer. But it's really good. Like I said, this is pretty unique to Massachusetts. I'm really not aware of any other state that has as stringent requirements, but I think it's a very positive thing we do. And finally, one of the biggest things we do is we respond to public health nuisance complaints. This could be a very wide open potpourri, basically, as anything that could be related to public health. Like common things we get are air quality complaints, noise pollution, livestock being held improperly, improper waste disposal, like people littering, or they're leaving their trash where they're not supposed to. um, our job as health agents is to maintain public our local public health regulations. We want to prevent pests. We want to prevent anything that basically we want to prevent problems before they become bigger problems. So it's very common for residents to reach out to us and let us know, hey, we saw this, we believe it might negatively affect public health this way. And these various codes me and Vinny have discussed, those are kind of the avenues we use to enforce, to make sure we have proper, clean residents and businesses. So that it's a very big basket. It could be anything remotely public health related, but I would say some of the most common is, garbage. Sometimes litter is an issue, and, we want to hold those responsible to make sure, obviously, waste is properly disposed of, because it's a big cause of pests. And from there, I'll bring on to Q&A time if we have any questions, Liz. And Vinny, if there's anything you want to add on any of those topics, totally feel free.
I do have one question. I'm not, maybe it goes to Vinny. If someone is having an event with food trucks, is there a process that they should follow?
So I am new to this town. Typically they would need they could, excuse me, apply for and Chris, feel free to chime in here.
Yeah.
So typically they can apply for a temporary permit if I'm
That's right.
correct, Chris.
So
Yep, and
basically, the
go ahead.
way they can do it is, if they want to do a temporary event, they can apply for a temporary license if they just plan on doing one event, or they could do an annual license, and that'll be good for the whole
Okay,
year.
excellent. And would they require a temporary permit? Would they require an inspection for their temporary permit, Chris? I believe they would.
Exactly. So
They would need an inspection.
it would be basically the same as at a restaurant. We just see it as a little
Right.
restaurant on wheels. Anyone new to us, we got to go in and do an inspection before the event to make sure, their truck is meeting all the food requirements. Which, yeah, it's some of them, you can have from neighboring towns where the inspector, hey, I inspected it. Here's the report. Looks good.
Right.
Make sure. And then as you get to know them, it becomes easier. So yeah, that is, so long as you have a permit and you're getting inspected, that's how that would work.
Yep. Like you said, a little restaurant on wheels. I like the way you put that.
Yeah.
And what about bake sales? If like a school wants to do a bake sale as a fundraiser, do they have to follow any type of requirements?
bake sales are actually exempt. They can operate without a permit from the local Board of Health. That said, it has to be all items that are non-perishable, and there has to be a disclaimer that this hasn't been inspected by the Board of Health. That said, always welcome to request a permit if needed. Nonprofits, we waive the fee, so that's not going to cost you anything. But any questions could totally come to us. Sometimes people want to go a little beyond just the bake sale, like, hey, we're going to serve coffee, hot chocolate, that sort of thing. And again, it's not going to be you're not going to charge a fee for that sort of nonprofit, charitable school events. But just making sure things are done properly.
Are there any seasonal issues that you see more, like, some things more in the summer? Obviously, the swimming pools probably, but that residents should be aware of?
Yeah, I would say, things definitely come at different times of the year. Like you said, swimming pools and summer camps, it's like super busy lead up the spring into early summer, and then, it kind of quiets down. This time of year, there's not as much septic stuff going on, but it's going to get very busy in early spring once it starts to thaw. It can be harder to do the work when there's snow on the ground. And then, with temporary food events like with Vinny, it's a lot more popular in the summer or fall. Weather's nice, so people are outside. So I always kind of think I was like, public health is definitely a little busier when it's nicer, warmer out.
Right.
But it's a year-round job.
Right, right. And then going back to your discussion about camps, if they're called a camp, then is that what has them fall under your standards, or is it how many kids are there?
So it can be both. It is kind of a long list of what constitutes a camp, but like you
Mhm.
mentioned, if you use the word camp, you are automatically a camp, even if you don't meet the definition otherwise.
Okay.
So kind of interesting. A good example of that is you'll have, a program that's strictly classroom based isn't required to have a recreational camp license, but if you call it a camp, then you are. So it's one of those things where it's like, it sounds silly, but that's the state law. So you want to basically market it as a different word. But beyond that, the very basic of camps, there's different types of camps. There's just day camps, there's sports camps, there's overnight camps, there's travel camps, for camps that for kids that go like Six Flags, different places. Um, so basically, it kind of depends on the camp. But basically, if you are running a business where kids come for recreation over the summer for a span of more than 3 days, you're basically a camp. And technically, it's almost always over the summer. There are some that will operate beyond the summer during like school vacations, but yeah, it's super busy, especially as school gets out mid to late June. That's when it's busiest.
All right. Are there any other questions? I know I saw a few people join in the audience. All right then. Anything that you guys want to add in that you haven't already covered? Otherwise, I appreciate your time and all the information. It's a lot of information. And again, this is being recorded so that we can have it on the YouTube channel of Northborough Media Connections so that it can be shared around and be a wealth of information for viewers.
No, that's
Anything else?
excellent. Just
You're,
one thing I'd add is
yep.
use this as a resource. Always don't hesitate to reach out. If something concerns you, anything vaguely resembles public health related, we're happy to help. At least guide in the right direction or provide assistance as we can. Public health is very interdisciplinary, and it's kind of interesting because I kind of see it as two sides. We have the medical side of public health, and then we have the environmental health side of public health. So it all kind of connects. And,
Right.
that's kind of our niche of public health. As people probably could see from this presentation, there's a whole lot of stuff that goes jack of many trades. But yeah, I would just encourage, residents to use this as a resource.
Great. Well, thank you so much for your time.
Absolutely.
All right. Enjoy
Thank
the
you.
rest of your afternoon.
I'll see you guys. Thank you.